Once again, we are still looking at the COVID-19 easing of lockdown as far as Nigeria is concerned, and measures that have been taken so far. With us in the studio is Professor Tomori. It's a pleasure having you on Sahara TV, sir.
It's my pleasure too.
As an expert and based on research, having been able to isolate and analyze the virus, including samples that were taken from the patients, what do we know about this virus in terms of its characteristics and its elements, sir?
Yeah, I think most of the information that we have actually have been on what have been done in other countries. We've not really isolated anything in this country. So we have information about what happened in Wuhan, what happened in other parts of the world, and information about this, that this is a coronavirus. The coronaviruses are not new. They've been there since in the 60s, 70s. You find coronaviruses in animals, and you also find them in human beings. You find them in bats and other places. So they are common viruses which are found all over. We've had one or two outbreaks of diseases, but not as severe as this one. First one with the SARS-CoV, number one, and then which was that happened in parts of Asia. And then we have the MERS-CoV, which is the Mediterranean one that occurred associated with camels, which human beings were also infected. The third one is this one, which is the COVID 2019, which is now first associated with bats and has spread into the human population. This is expected. When humans and animals meet together, we exchange the viruses that we have. And so due to changes and mutations and different things happen, a virus that is normally behaving very well, that doesn't cause any major problem in an animal species, may end up causing in another species. And that's what they call something about jumping genes, the jump species, the jumping species. They jump from animals to human beings because of our relationship. So take a few examples like yellow fever, for example. It's usually a disease of monkeys. But when we invade the forest, when we build roads, when we take over the forest area, then mosquitoes that are there take the virus from the monkeys, infect human beings, and over a period of time, we then get the disease. So that's the same thing has happened with coronavirus. Found in bats, found in human beings also. But some of the cases of the bats have jumped into the human species, causing the problem we have. Why are we having such a big problem with it? It's not every mutation that causes problem, but some of them will cause problem. Particularly in this one is the fact that it has on its surface a receptor that can bind very easily with human cells and cause the infection that we have. So that's simply the way we can explain it.
Now, Prof, let me get your perspective on this. Nigeria just recently eased restrictions as far as the lockdown is concerned. And there are predictions that there may be a grim rise in the number of cases as we begin to open up, and we still don't have enough testing in place. The doctors and other experts like yourself have also said that it's too premature for Nigeria to have eased down the lockdown at this point in time. What's your reaction to this, sir?
First, let me say one thing. There are two sides to the lockup. The government is the one that does the lockup. But what is done in the lockup is the business of the people. When I say there are two sides, there is also the side of what do I do to protect myself. As I usually say, COVID will not kill the government. It is individuals that the virus affects. And therefore, the most important action that needs to be taken is by the people. How do we ensure that I don't get the COVID virus? How do we ensure? And simple guidelines have been put in there. Cleanliness, hygiene, wash yourself, wash your hands with soap and water. Because of the nature of the virus, it can easily be destroyed by soap and water. Keep a distance between you and the person next to you, because of the way the disease is spread through sneezing and coughing. And therefore, if you are not within the range of the sneeze and cough, then the droplets will drop on the ground, but not on you. But you are close enough, when they sneeze, when they cough, the droplets that contains the virus will then get into our mouth, into our eyes, and then cause the infection. They also talked about the fact that people who are sick should self-isolate, so keep themselves away so they don't infect other people. Another easy way, another way to do is that they wear face masks, because especially for health workers who are very close to sick people, they don't know who is coming to the hospital with COVID until they start infecting them. So they need to provide this protection for themselves. The mask, what it does, holds the virus, holds the droplets and whatever, so it doesn't allow you to spread into people. But of course, you have to take good care of it also. But it's also for you, because you don't know who is actually having the virus. And so when you are passing the midst of people, you need to have your face mask on, which also protects you from getting the droplet or whatever it is into you. So I don't think we as citizens have done our part of the lockdown. And that's why when you look at the lockdown, actually from one lockdown to another, the numbers have been actually been doubling. I think it was about 130 something when we first did the lockdown. Then it shot to 300 and something. Now it was 600, and now we're in the 2000s. And it's going to continue, because I think prematurely we will open our doors to the people. And then if you look at what happened on the streets of so many of them, people are not showing that those things that we say will help you not to get infection. Mixing, they are not wearing gloves, they are not wearing face masks, and so we expect a harvest in another 7 days or 2 weeks, a big harvest of COVID cases occurring in the country.
That is quite ominous. Experts have also looked at the testing capacity that Nigeria is having issues with. In fact, the issue of testing capacity has been on the front burner in recent time. And they've said that if you can't identify where cases are, if you can't do the testing to find people who are infected and then isolate them, we risk going backward instead of forwards. Your thoughts on this, sir?
Yeah, indeed, we've said for a long time from day one that we're not testing enough. And if you look at the testing figures for Nigeria, I think we've tested about, I can't remember, about 7,000 in the last week.
We've gone about over 10,000, sir.
Yeah, okay, 10,000 for a population of 200 million people. Look at other countries, smaller countries, they've tested much more than that. South Africa is doing exceedingly well. Ghana is doing quite well. So when you look, the good thing about testing is that it helps you to know the magnitude of your problem. You know who are positive, you know who are negative. And in particular, in a disease in which people who are not showing symptoms are actually infected and can be a source of infection to other people. What is causing, I mean, our case definition in Nigeria for testing is that if you have had contact with somebody who is positive and you are showing symptoms, then you come for test. But that is only looking at how you're missing out on about anything between 20 to 30% of your population who may actually be infected but are not showing symptoms. And if you are there spreading the thing, you don't know how much they are spending. Another issue is that the time interval between getting the result, what they call the turnaround time, of when you submit your sample and when you get your result, sometimes it takes about 7 days. In between that interval, you are positive, I mean, and the result that comes out today does not mean it's today you're positive. It is when you took the sample a week ago. So that week, you have been there, possibly spreading disease all over the place. So it is important that we know who are positive so that we can do a proper isolation and proper contact tracing. If I know this is the person that has it, then I know where he has gone to. And the earlier I know that one, the better. Not only the better for me to be able to trace him, but also the better for the fact that there's a limited time for that person to spread infection. So we're not doing enough. And the reason why we're doing what we're doing is because we are a country that depends on donation. The issue of this time now when we have this problem is not to depend on JAKIMA or UN to provide us with the kits we need for testing. We should take our own money, go and buy them. But then there's also the problem that we don't know what kits are good or what are bad. But we have excellent people in this country who can run through, together with NAFDAC and other people, test all these kits that are coming and tell us which ones are good to use.
Well, Prof, I mean, still on this testing capacity, and based on what we've observed and seen worldwide, the easiest solution to all of this would be extensive testing. And considering the fact that all countries that are successfully emerging from this lockdown, why has it been so difficult for Nigerian leaders to grasp that if there is extensive testing, you can isolate and contain this virus and everyone can go on with their lives? Instead, we are seeing the country open up with insufficient testing and contact tracing. Why?
You know, the problem is we are solving the problem of yesteryears today. what we're doing, looking for labs, looking for where to run them or something of that nature, is what what the people call making your bullets at the war front. All the things we are doing now is like we are putting vanilla icing on a rotten cake. And what is the rotten cake? A health system in the country. We had labs in this country, but we abandoned them. And in fact, we're not even, I used to say something, we have all it takes, to solve our problem if we take all we have. But we're not taking all we have. Let me give you a good example. Yeah. There are over 300, 400 laboratories, which through foreign donation have machines that can run this test. They are found all over this country, all over. And it is for us to identify those ones and make use of those resources instead of building new laboratories or trying to set up new laboratories based on what we have. We have more than enough. And long before this issue came up, we'll have the activities should have been more than just looking at, building isolation walls. The laboratory side should have been looked into. The issue of science and research should have been brought into it, which we are not doing. And so we have a country where there are resources lying in different places. There are talents lying in different places, but we're not going to make use of them because we are so short-sighted in the things we're doing. We don't even have information about what are the things that we have. Finally, I think let me also make one point. There are many times that we have disdained research and science and research in the country. We are consumed other people's findings. We find it so much cheaper to do that instead of building on our own. And the people who, at the end of it all, it is the man who gives you who benefits more than the one who is receiving. So all of these kids that are coming into the country is money for the countries that are there. Yet we had laboratories in this country way back in the 60s and 70s. They were producing their own reagents to run tests for the country, for all the diagnosis we're doing. But somehow we abandoned everything and preferring to go outside the country to solve our problem. And that's where we are today.
Now, Prof, has the measures taken so far helped contain the spread of the COVID-19 virus in the country, from your expert perspective, sir?
You see, I said at the beginning that there are two sides to the lockdown and all the steps they're taking. We as citizens, we have a role to play. And that is by following the guidelines about those safe distance, wear mask, and all those kind of things. The government has a role in alleviating the suffering of the people, on the day-to-day worker, which who don't have their source of living, who depend on a daily need to go out. Government has not really done very well in that one. It's probably because of lack of poor planning. When we decided to lock down, we didn't think far ahead. What is the implication of this lockdown to the life of the people? Otherwise, all these things we see, people donating food and serving, it should have been probably well planned, much better than we're doing. That's the first point. On our own side as citizens, we too should have taken the aspect of keeping ourselves, improving our hygiene, keeping our environment, washing our hands and all those things. So because of the failure on both sides, and that's why we're getting the escalating numbers of this thing. So while we blame the government for some of the things we're doing, we too ourselves should also blame ourselves for not following the guidelines about hygiene. You may turn around, how can you do self-isolation when there are so many people living in different places? I used to say one thing when I was growing up. This is not the first time we're having epidemics and pandemics in the country. When I was growing up in my village, you keep your house clean, you sweep your house, you remove your dirt, the next man does the same thing, the next man does the same thing, and the entire village is clean. So it's an individual thing, and we need to make sure that we've complied with the guidelines that government gives us, while at the same time calling on the government to do its bit in alleviating the level. If they alleviate the problems of the people, you won't have people rushing out as we did on that first day, on Monday, when virtually banks and markets were as if we had no problem, and people not using what they required to use. Over.
So the big question now, sir, is how do we beat the odds here and still open up the country? If people continue to be strict about social distancing, wearing masks, as well as washing their hands regularly, the guidelines that have been enunciated and you've actually highlighted, could that help beat these terrible odds?
It has helped many countries. Many countries have used the same thing to I mean, in fact, maybe we're not a draconian country like say China, for example. See what happened in Wuhan. See the way they locked down the place. See the way they made sure that everybody didn't mess up. And they're now over the problem. So we have to suffer some of these things. This is a major problem for us. If we're not ready to suffer, I mean, do comply with what needs to be complied with for a shorter period of time, or whatever time it takes, it is going to drag on and on and on. And we will never see a solution to it. As I mentioned, the government itself must be prepared to look at the implications of the lockdown. And they must also be prepared to look at the implications of lifting the lockdown, before time. One of the things I used in describing the lockdown was that you are putting us into an enclosure of life. And when you lift it up, you are putting us into a free range of death. Maybe that, I don't know whether that explains it. The lockdown encloses us in the hope that we are protected. The free range to go out and do what it means we are exposing ourselves to death. So when we lock down, we're locked up for life. When we're free, ease of the lockdown, we have put ourselves in a position to increase the death amongst us. So we need to look at that as it is. For me, I hope the government will not go back again to full lockdown, because when the numbers start increasing, we'll have to do something. But if they have to do, then we need to make sure that all of those things that people complain, the palliatives, how do you get things so people are taking adequately care of. Once we do that, I think our people will also will be made to comply with those other issues, which they have to do on their own individual basis.
Now, Prof, what are the effective practices in treating the virus now while we continue to work on pathways to prevent the virus?
So you're talking about what are we doing to treat the infection or to take care of the virus?
Exactly, to treat the infection, sir.
Okay. Well, for now, this is a disease that is coming on. Each day, something new comes on about the virus because it's a new virus. And therefore, we learn by the day, which means we have to be up and doing. We have to be proactive. We have to keep ourselves abreast of what is happening in other places. What other symptoms are they coming up? What is the mode of infection? What is all those are factors. So our people must be on the alert, keep their eyes open to what is going on in other places. So far now, there isn't much you can do other than to look at the person and treat the person symptomatically. You look at his fever, you look at his respiratory problems, and you look at all those things and address those individually. Of course, we know, as we said, it becomes more complicated in the elderly people, because of underlying problems. So you have to also remember those underlying problems when you are treating the people. And I don't think we've been a bit lucky when you look at the number of people that have died compared to what happens in other parts of the world. The disease has not been as severe as been found in other parts of the world. The reason for it, we don't know, but these are part of where science and research comes in. Why are we having so few cases on isolation, on admission, as compared to other parts of the world? But even when we say that, even our own system is already being overwhelmed by even the few people that are on admission. We are hearing now that we need more beds in different places, that some of them are congested and overwhelmed. And one other issue, which I think we're not taking care of, we need to combine the continuous testing of those people. I'm told in one of the isolation wards, some of them have been waiting for the last 7 days, waiting to check their bodies, whether they're actually free before they are released. So if you keep them there for 7 days before they get the result, we are complicating the matter. So side by side, we test and all that. We need to pull all that together to make sure that as people are free, you release them so that there's space for more people that are coming in. But if we don't do that, we're going to have people who are sick outside, people who are no longer sick inside the isolation ward, and that's the complication we're getting right now.
Prof, let me just also ask, could you help us with this, help us debunk some of these claims that chloroquine, considering the fact that some have said that the virus itself contains elements of the germs of malaria, and could chloroquine be used to cure COVID? That's claimed by some. And we also want to get your perspective too on the use of herbal remedies. For example, we have a country like Madagascar already having a natural remedy, so to call, which they call COVID organic, and that they claim that it could actually cure the virus itself. considering the fact that Madagascar has not had any case. And even the World Health Organization said that, I mean, I'm not really too excited about this. So help us debunk these claims. Can chloroquine or herbal remedies cure coronavirus?
Thank you very much. There are a lot of claims, about what can cure, what cannot cure. But there's a standard procedure that people use to confirm claims. There are a lot of theories, but they must be confirmed. There's a process for confirmation of cures or drugs or vaccines. Not only must you test them in vitro, that is, you test them in a situation, in the laboratory setting, and then you do series of what we call clinical trials over a period of time to test for the safety of the drug or the product, and also to test for its efficacy, whether it is efficacious and can protect this thing. Unfortunately, I mean, personally, I'm for any local remedy that can be found, but they must be subjected to the process. I don't think what has happened in Madagascar is subject to the proper process, and that's what WHO is saying. Look at it. And again, it is not correct. Madagascar has cases, and people have died in Madagascar to COVID. So it's not that correct to say that they have no case or they have no this thing. They have had cases. I can't remember exact figures, but they have cases, and they are testing and finding positive there also. However, let me put it this way. That's where I mentioned the fact that we have disdained science and we disdain research. But we have NIPRID, we have NAFDAC, we have all those places. This is the time when it should be coming up with all these claims that are coming up. Subject them to tests, confirm them through standardly acceptable procedure, and then we can say with confidence. I said the same thing about kits that are coming in. There's nothing stopping us. Anybody can bring any kit, but let it be subjected to proper testing, to validation. And once we do that, then we'll be in a position to say with confidence, yes, you can use it, you cannot use it. But when you disdain science, when you disdain research, you are at the mercy of anything that comes from outside of the country. And let the cure we're looking for not become a cost for us.
Now, finally, we're all looking for some signs of hope, and that a vaccine will eventually come, maybe sooner rather than later. Let me get your sense on where things stands with the vaccine at this point in time, sir.
According to WHO, there must be close to 80 or more prospective vaccines. A few of them, maybe 3 or 4, have actually started the clinical trials in Europe and a few other, in the US and other places. But it will going to take another 6 months or even longer before we can say with confidence that this vaccine works or this doesn't work. But bear in mind, we're dealing with a respiratory infection, which is slightly complicated with other issues. The influenza vaccine that we use is actually concocted, let me use the word concocted, it's already produced every year. The word is compiled. I mean, you look at the current seasonal thing that is going on, and you make a vaccine out of the series of strains of viruses that are going on. Because this is a mainly respiratory infection, people have some doubts about how good and how well that the vaccine could work because of its respiratory disease. However, I did mention that this is a disease, we don't know the total spectrum yet. So maybe as time goes on, between this next, we will see that the disease is more than just a respiratory infection. Vaccines will be tried, and they are on right now. And I don't see any vaccine being ready, even because of the nature of the problem. They are actually being rapidly done. Ordinarily, a vaccine would take anything from 2 to 3 years, but now they're scaling it up because of this major problem, and doing things much faster than they are doing. And so maybe by the middle of the year or towards the end of the year, we should have some vaccine that can withstand with confidence that is working. But then we don't know until this is tested whether the vaccines will actually work or not.
Let me also get this, Prof. Finally, as a matter of fact, what should be done by the government to ramp up the testing capacity of the country at this point in time?
For me, 2 things. Get our technical staff, our technologists, our scientists, together with NAFDAC, work on the kits that are coming in, which some of the countries have not approved. let them confirm for us which of them are good. And then they will validate this side by side with the PCR, which is the technique we are using right now. And once we've had that one, and we have the kits, I know they're quite difficult to get now, but if you are waiting for donations, you're not going to get it. If you have your money, you can take that and go and buy your own kits. And that gives you more kits to test more of your people. And then you know, and then you'll be in a better position. For example, one of the information that I received of the number of over almost 3,000 cases we have now, close to 40% of them, they don't have complete information about where they are, what their location is, where they got the infection. We need to improve our case investigation with all the details, which also means the people who are infected themselves must be transparent, must tell the truth. I mean, if somebody has traveled and says he has not traveled, if somebody has had contact with the case and says he has not had that contact, then you're not helping the situation. You are giving problems to the people who are working on it, because if you don't know where they are, they don't know where you have been, then they don't know which contact to go and trace. So truthfulness on all our side, accountability and transparency on each side, both Bulgarian and the people, will help us to clearly mark out who are the people affected. Then we can do our contact tracing quite well without any problem. And so these are some of the issues that I think we need to look at. And then now, if we now find those kits that are good, it is important for our people to dip our hands in our pockets and use some of the money we have to buy our own kits for our people, not depend on the donation by Jakima or UN. I believe there's still enough resources. When we begin to ask questions, all the COVID, the coalition against COVID, all of the money that is donating, how has it been spent? There's no transparency from the side of the government to tell us how that money is spent. Why can't they put some of this on into getting more kits for the country rather than depending on donation from outside the country?